Well, it's a disturbing new study showing drug overdose deaths in this country rising for the 11th year in a row. We're going to talk about the biggest killer and why it's so hard to get this problem under control, even though it's so well publicized. Plus, yeah, not a good place to play the washing machine. Note to self, right? A new study says drug overdose deaths are up for the 11th year in a row. Most of them are called accidental and involving addictive painkillers. The head of the Centers for Disease Control and Prevention says the problem is quickly getting worse, not better. And it's because, according to them, that doctors are prescribing more powerful medication than their patients really need. Joining us now, Schrank, an addiction expert who runs a recovery program called Rebound Brooklyn. So you see this on a regular basis. You come face to face with some of these addictions.
We see this daily. Yeah, absolutely.
In your experience, what has it been like over the years when it comes to pain pills and how that compares to other addictions? How dangerous is it?
Well, it's lethal. I mean, just to put that into context, overdoses kill more people than breast cancer or car accidents. Most people know somebody who's been killed in a car accident. I mean, so just to kind of get your teeth into what we're really dealing with here in the epidemic proportion of overdoses, the opiates have ratcheted it up significantly over the years as we see a steady incline.
You know, it's interesting to see that incline because even the Associated Press, as they were writing about this headline today, said that, again, deaths are up. Federal data is showing this. Most of these deaths are accidents, quote unquote. And despite the growing attention that a lot of these medications are really dangerous. So we're giving it more attention, but it's still getting worse. Why? What do you think?
I think that we do not discuss addiction for what it is, which is a very complicated mental health issue. You know, as long as we have that undercurrent of trying to incarcerate or blame or punish our way out of it, it's not really going to get better. We've seen a decline in heroin use, as we've seen a rise in OxyContin use. And so it's the kind of problem that just doesn't really go anywhere. I don't think that we've approached it very well.
Do you find in your work it's because that doctors are writing prescriptions and not really knowing the signs of someone that could be addicted and doesn't need it, or is it something else?
No, absolutely. One of the things is that doctors are not trained in medical school to look for addictive behaviors. So one of the things that we would advocate for as a way to reduce this is exactly that. Simple screening instruments, your doctor asking about your family history, if you've ever been in treatment before, do you drink alcohol? Because one of the things that's not mentioned in that is that it is a very lethal combination. Alcohol somehow gets a free pass, but most of, I don't know, but I would guess that most of those accidental overdoses are when people are drinking alcohol and then taking the medications.
What do you see as a solution?
A massive reframing of how we view addiction in America, a congressional hearing, reframing it as a health issue rather than something that can be incarcerated.
Do you think these drugs should be on the market? In general, the benefit, I know you're not a medical professional,
yeah.
But the benefit of these drugs, you know, some say are great because of people that need it for, pain.
Yeah, absolutely.
But one wonders when we see this type of rise in addiction, too.
I think that they have a byproduct, that there's an actual medical application for people suffering from all different kinds of pain, cancers, and they have been beneficial when taken as prescribed under medical supervision. They have an application. They also have a downside, and I think it's the downside that we're not addressing, that it's a very common thing to have wisdom teeth out. And to have a Vicodin prescription, if you don't finish it, then you have uncontained floating Vicodin in the community.
It's an example that I think a lot of us have experienced with pain pills and when you get them prescribed and what to make of it all. Joe, thank you very much. Great to have your expertise with us today.
Thank you.
We'll be right back with more happening now.